demonstrating and going through the treatment of a PICOSURE laser. The benefits would be acne scarring, skin pigmentation like brown spots, any sunspots, texture of the skin, fine lines, wrinkles. Right now I have my patient in front of me. We are going to be starting on her face. She does have numbing cream on, so what it does is you put some numbing cream on before, ahead of time, about 15-20 minutes, and it helps get her numb. So it is a little bit stingy. It uses warm heat. Maybe it's kind of like a ticking sound. Tracy has some really good brown spots here, sunspots. So it'll be a very good area to kind of be very focal on. All right, so now that we removed all of the numbing, we always put on some titanium goggles. Down and lift your head off the pillow. And then I'm going to tighten underneath your ponytail, just a smidge. And how is that? Good. All right. We don't want them super tight, but we also want them kind of locked in there a little bit. Yeah. All right, Tracy, I'm going to have your hand and I'm going to place this right down. This is what this guy looks like. You can see the tip here. What we want to do is kind of graze the skin with the tip. All right, so we are going to start with our test spot right over here, right underneath the ear. So we just give it a couple seconds, let it kind of develop. Just a little slightly pink. So that's the green light. We can go ahead and keep going with treatment. Kind of like a staticky feeling. So, but it doesn't typically hurt throughout treatment. She's going to get a little bit red, maybe a little bit of swollenness, but that's all very normal. All of that will kind of subside within an hour to 24 hours for most patients. I'm just very lightly grazing the skin with the tip. Got kind of this little deeper line right in between the chin. That's somewhere I will kind of pull out and kind of get right in there.
It feels fine. I don't feel anything at all. Just a little bit of heat, but no pain.
Awesome. All right, I'm going to have you turn this way. Definitely hit those crow's feet a couple times. She does have a nice little pigmented lesion here, brown spot. So we'll kind of hit around there a couple extra times as well. The more you do, the better you're gonna look. Around right in here is where a lot of people have an area of concern, is kind of that smile line. You can see right in here, that's kind of an area where I'm going to focus on, and then also still that little divot right in here on that chin, okay? With the Pico machine as well, with the laser, we are able to kind of hit all over. We do legs, we do arms, we do spot treatment. So today Tracy is doing her face, neck, and chest, but we've had people do their legs, we've had people do their arms, you know, we can do your back, any area that you feel you have, you know, any sun damage. As you can see too, her sun damage, her brown spots are starting to already just darken, which is a very good sign. Really good place to end. As you can see, like I said, she's got some redness, a little bit of swelling on the side, a tiny bit, but definitely darkening of those sunspots. So all that is a really good clinical endpoint. So after treatment, once we got into our clinical endpoint, we will remove the goggles off your patient and let there be light. Open your eyes slowly. Apply a cold gel mask. This is just to help kind of give some comfort after all that heat. And it feels amazing. It does. You can either do it for your patient, or some patients like to do it themselves. You'll come back every 4 weeks, which is every month in between your treatments. And then every time while you're outside or driving anywhere, you definitely want to use an SPF of 50 or more, and of all the areas that we are treating. We want to be protected. We don't want to have any a tan or anything that can kind of cause the laser to cause a burn or irritation, anything like that. So we definitely want to be on our P's and Q's when it comes to our SPF. Keep one with you, that's kind of what I do. I have one at home, I have one in my car, I have one in my purse. You can never have too much SPF, that's for sure. For aftercare, there is a few things. You definitely no hot water today, okay? No super hot water. You want to kind of stay away from anything that could irritate it, cause a little bit of a burning sensation. You want to, if anything kind of scabs or any flakes off, you just let it be. Okay, don't touch it. And if you have any questions or any concerns, you always give us a call here at the office. We can always answer any questions for you, or send any prescriptions that we need. Yeah, we'll see you back in 4 weeks, Tracy.
Sounds great.
For maintenance with SPF after our laser treatments, you're here because you have a little bit of sun damage, and so we definitely want to continue to use the SPF. It's always very important. I'm going to lather her up, so she's going to be covered for about 90 minutes. So if she, such a nice day today, if she were going to continue to go outside, in about 90 minutes she would have to reapply some of that sunscreen.